hear cancer is fed by sugar. Stop the sugar, don't eat sugar. What is going on? It's called the Warburg effect, and that is where glycolysis comes in. So the cancer cells will ferment glucose into lactate even when oxygen is present, which normally does not happen. Why do they do this? It's because it helps them grow faster and it avoids the oxidative stress. So AMPK is involved because it may reverse or suppress this effect, which makes the cancer cells go back to their mitochondrial respiration, which slows them down or even causes apoptosis or programmed cell death. So where berberine comes in, it is going to activate the AMPK and it's going to inhibit the mTOR. So there were 3 studies that I found, all in 2020, and what they're showing in breast, colorectal, and liver cancers, it's going to slow the cell proliferation and also induce autophagy and even apoptosis, which I mentioned is programmed cell death. And this study, it says individuals 18 to 75 who had at least 1 but no more than 6 histological confirmed colorectal adenomas that had undergone complete polypectomy with 6 months before recruitment were recruited with this randomized controlled trial. So this went on for 2 years, and what they showed was out of the 429 in the berberine group and 462 in the placebo group, 155 participants in the berberine group and 216, so 36 to 47%. In the placebo group were found to have recurrent adenoma during follow-up with this unadjusted relative ratio. However, no colorectal cancers were detected during follow-up. The most common adverse effect was constipation. So the conclusion here is that berberine 300 milligrams twice daily was safe and effective in reducing the risk of reoccurrence in colorectal adenoma and could be an option for chemo prevention after the polypectomy. So let's recap. Berberine supplementation 2 to 3 times a day up to 1500 milligrams a day is going to activate AMPK, which is basically a metabolic reboot. It helps balance insulin, reduces inflammation, and is going to help slow down mTOR. AMPK also opposes that Warburg effect, so it is going to help suppress the cancer cell growth. And for the best effects, you want to pair it with walking, fasting, even